Email us or connect with us on social media.
With NHL Center Ice, you get a premium ticket to the games you want every night of the season. Catch every key out-of-market matchup each week. You'll get more goals, more saves, more non-stop action from the teams you love. NHL Center Ice, part of the Rogers Super Sports Pack. All this for only $35.95 a month. Order through your remote on Channel 450 or call 1-888-ROGERS-1 today.
This is Rogers TV.
Hello and welcome to the Rogers TV COVID-19 show. My name is Carol Merton, and before I welcome our guests today, those of you who watch the program know that I like to say a few words just at the very beginning. On Thursday, January 14th, 2021, as part of the declaration of the second provincial emergency, a stay-at-home order was issued. This order and other public health restrictions are aimed at reducing the number of daily contacts with those outside of your immediate household. We are all now on the front line. We're working together to stop this virus and the variants from spreading. The virus will seek every opportunity it can find to get a loophole and to spread. Let's not give it that chance. This is hard work for all of us. It is hard to be isolated and have our daily routines disrupted. It's been going on for a long time, and we're all weary. On the horizon, though, there is hope. In the next few months, more vaccine will become available to those who choose to be vaccinated. For now, though, never underestimate the value and importance of what we are doing by following the Public Health Unit guidelines. The sacrifices that we make each and every day are helping to prevent the spread of COVID-19. We are saving lives. Thank you to the community for working together so that we can enjoy the freedoms in the future after we are vaccinated and after COVID-19 has been contained and controlled. I want to thank also our guests who have been patiently waiting while I went through my introduction. So I'm delighted to welcome Police Chief Craig Ambrose and also to welcome Jason Cranny, both from the Owen Sound Police Services, to talk to us about COVID-19, how the police services is coping. Now, Jason, you're actually in a slightly different role. You know, obviously we know the chief is the chief, but Jason, can you just outline your role a little bit for me?
Sure, happy to do so. With my role as a community service officer, I do a lot of outreach in the community. Certainly when schools are up and running, I do work with the schools, both private and public, here within the city limits, but also work with multi-intergenerational work with seniors right on through to our youth. Some of it, I mean, if it's not COVID or the COVID restrictions are actually subsided a little, some of the work is actually in the community, in the downtown core, special events, you name it. And it's all about, crime prevention and safety, a lot of education, and then developing and maintaining strong partnerships within the community. So kind of a wide variety, but it certainly keeps them busy, that's for sure.
So Police Chief Craig Ambrose, you are holding things together in the middle of this pandemic, an experience that none of us have really been trained for or ever anticipated. I want to thank you first for all that you're doing for the community. And there is a concern, and I know we've exchanged some possible questions for the program. You had gotten back to me about talking about the effects on first responders because COVID's gone on for a long time. I'm wondering if you can fill us in, first of all, how are people managing, with the work that they have to do as first responders, and also you as being in charge of all of these people?
Thanks, Carol. I think it's really important to recognize that there are a number of challenges that we're going through, and we're going through this pandemic, and it's really unprecedented. Everybody understands, when there's a flood or if there's a hurricane or anything like that, and you have an extended period of time, and that might be a week, that people are at heightened awareness, that people are on top of things. We're going on almost a year now, and it really hasn't changed for people that are working in frontline first responders as far as the level of demands and the fact that you're living through this at the same time as you're protecting and serving the community. And it's really starting to take its toll on everybody. The demands on people, not knowing whether their children are going to be going to school, not going to school, for those that have school-age children, and working shift work and front line where you don't know who you're coming in contact with at any given time, whether or not you're being exposed to the virus, whether you could be bringing that home to your family. Those are the types of things that usually in most of these situations, they go on for a day, a few days, maybe a week. This is unprecedented, and it's really the cumulative effect and the cumulative stress that's taking place, especially in all first responders. In the community in general, though, you can see it as well. And it's really a concern for all of us. And certainly our mental health of our members is one of my primary concerns.
So how are you addressing this? What strategies are in place or can be in place? And how do you recognize it?
So certainly recognizing it, the sick time, absences, stress-related things like that. Even the workplace atmosphere, you can tell when there's stress in the air, when there are people that are stressed out. There isn't that method of burning off the stress. We had to close our weight room and our gym facility for those who use that, just like the community. Those are the types of things where you recognize that there aren't those regular outlets. Even just gathering as a group, gathering as a shift, that isn't an option anymore either. So you're losing those outlets, you're losing those possibilities. One of the things that we're really proud of, and it happened before me, and I give credit to my predecessors, we have a mental health professional that comes in and deals with our members on a regular basis monthly. And so that individual recognizes and kind of takes a barometer of what's going on in the police service. And then we've looked and we've gotten some opportunities with our benefits provider at looking at mobile apps and different options that we're trying to roll out in order to provide more opportunities for services to our members, especially during these times.
So certainly being able to reach out to the members is critical, even with the technology like we're doing today and having our interview by technology. This is not going to go away. We're facing a few more months for sure with this, so it makes it even more critical to be able to give those supports, I would think.
Absolutely. It's not going away. It's not going to end quietly. The second wave, I think, if nothing else, it's shown the community, it's shown everybody that this virus has a strong hold in the community, in the country, and around the world. And everybody's, whether or not you're getting to the point where you're a little bit frustrated and you're tired of the lockdowns and the restrictions. I think just around Christmas time, we saw what happens if you don't follow those lockdowns and restrictions, and we're paying the price for that. And unfortunately, it's a public health epidemic, and people are dying. So much as it's going to be difficult to keep going, our members keep on going, coming to work every day and doing their job, and the community has a job to do, and that's to maintain those, follow those guidelines that are put out by public health and keep everybody safe. Despite the fact that it's to the point where everybody's a little bit tired of all the restrictions.
Yeah. My newer phrase is people are getting COVID cranky. I mean, it's just the tolerance is not there, and it's just very, very difficult. Now, as far as the police service, we've talked about the stress on the first responders, and really, you phrased it in a way that created a different approach for me. We know that people are grateful, absolutely, for the actions of the first responders. But by people following the public health unit guidelines, they're actually helping the first responders, because the sooner we're out of this COVID situation, the sooner that the health and well-being of everyone can be reestablished. So it's the way the community can also assist those first responders by not taking chances, not doing the risks. I'm wondering about the community. We know the stress in the first responders. Are you seeing more calls, more stress-related calls? And can you speak about the opioid overdose situation here in Owen Sound, and I'm sure throughout Grey Bruce?
Yeah, certainly. Anecdotally, I would suggest that we are in a position where we're seeing a lot more calls for service related to mental health. And I think it's quite obvious as people's financial troubles are catching up to them, and business lockdowns and livelihoods, it creates that much more work for people, and it's that much more to have to cope with. So I think when you see that, you recognize the fact that that people's mental health is deteriorating in general, and there's a lot more stress on everybody. So we're seeing that in calls for service. And I think you're also seeing that as far as opioid use, and substance abuse, and certainly our overdose numbers and our number of people involved with calls for service relating to substance abuse appear to be increasing. And whether that's the drugs that are out there right now, or whether it's a sign that there's more people using, I couldn't say for sure, but certainly we are seeing an increase in the number of overdose calls. And I think that everybody has to be aware that that's also another public health epidemic that we're going through concurrently with this one. It doesn't affect everybody the same way COVID-19 does directly. It affects everybody overall, and it affects the community greatly. And my heart goes out to the people who have lost loved ones to that epidemic as well. But I think that if anything, this public health epidemic has really opened everybody's eyes to the fact that the number of people that are dying in opioid deaths is probably higher than, especially locally, is higher than it is with the COVID-19 pandemic, and it's higher than traffic accidents, but it doesn't seem to have the same focus. And I think that needs to change moving forward.
And that's a really important point. I mean, people are dying because of the opioid in this greater numbers. I can't help but think of the impact on the first responders who are at the scenes when they can't revive or resuscitate those who have taken an overdose.
Yeah, certainly. Anytime you're at a call where somebody passes away, it's a difficult call on all of our members, let alone somebody in the prime of their life losing the battle to their opioid addiction. We were very fortunate last week that we were in the right place at the right time, administered naloxone that we had with us, and started to commit to doing CPR for an individual, and actually got that individual back, which was pretty remarkable and outstanding work by our members. And that individual lives another day and can enjoy their life.
Jason, I didn't forget you, really. So we're moving into the spring. Mm-hmm. And I'm wondering if there's anything that you would like to highlight as we move forward into the spring around services. Is there anything we can look forward to for spring and summer?
For sure. I think the one thing I do want to mention, and just kind of reiterating what the chief had said, that there's a lot of difficulty. It's a difficult situation, and we have to, it's kind of a tightrope in how you deal with these really delicate situations, and you want to make sure that you're there to help in all respects. But as we move towards the spring and into the summer, and for some people it seems like it's a long way away, but given the year that we've just had, I like to think positively and that things are going to definitely improve. And they did last summer for a little bit, and they gave us a little bit of a relief. But as we move forward and the lockdowns hopefully will subside a little bit, and as you mentioned right off the top, Carol, that the vaccines will start to roll out, and we get hopefully continually to get some positive news from the province, we'll be able to do a few more things. And some of those things will be getting our auxiliary officers back, which means, as the chief mentioned, there's a lot of things that our members can't do, and no different than anybody working in any other organization, just being able to get together and having a few laughs, and for us also giving back to our community. That's really important, because when people call in here, they're usually negative calls. So officers are usually going to a lot of stuff that it's difficult stuff to deal with. So it's always nice when we can give back to the community, whether it's whether we're downtown interacting with the community at a Santa Claus parade, or the Festival of Northern Lights, or a community barbecue. It's always nice to do that and have a few laughs with the community. So we're hoping as things open up that those opportunities can present themselves. And our auxiliary officers back as well, because they're a great volunteer arm of our organization. And we've been really fortunate to, re-continue, and then we will continue to hire young people whenever possible, with the hopes that they might one day want to get into law enforcement, policing possibly, but certainly law enforcement or education, or whatever field that they want to get into. Last summer, we had 3 summer students, and we currently have one doing an after-school program with us, working virtually from home and doing a great job. And we're going to continue to do that this summer and have them kind of an outreach. So the part that makes us, a community service so special is that we do, some of those extra things, and a lot of that is just being with the community and doing a lot of that outreach and that celebratory stuff, which we also enjoy a lot. So in the future, there'll be some postings for students. So if anybody knows somebody who might be looking for a job, the hope is that we'll be hiring again once the summer rolls around, and hopefully you'll start seeing our auxiliary officers back, in the community, in the streets, as things get better, and they're welcome back into the station, and we can get back out on the road. So anyway, I think that there's going to be a lot of positives moving forward.
And we need the positive. And
Yeah.
to think about summer students and the auxiliary coming back is definitely something to look forward to. Even if it's gradual, it's something to look forward to. The second wave, is there anything different about the second wave compared to the first, as far as the police services and the resources and strategies you've had to use?
Certainly, the lockdown after Christmas and the changes to the shutdown that we're into right now, the second wave, certainly people know by now what the rules are surrounding COVID, around the pandemic, around the shutdowns and such. So we've gone from more of an education to an enforcement role. That being said, there's still for education, and there's always officer discretion. So we're not strictly enforcing the laws without any other options. But I think it's important to note that we've issued a number more infractions regarding the lockdown this time than we have the last time, and everybody's well aware, despite the fact that everybody's growing tired of the restrictions, that we have that responsibility and to do your part. So that's one of the changes. Certainly the numbers there for a while were a lot higher locally, and so that changed our approach. We've done a lot more internally as far as safeguards, PPE, wearing our masks within the building, all those things that are required of the public, we do as well. And so it's changed our game a little bit here. We've had to cancel and postpone some in-service training that really it's been set up. It's set up annual recertification. We've had to put that off, and now the restrictions are lifting, we're coming up with a quick timetable to try and get it redone, because we have to, by legislation, get that completed within a year of the last time, give or take some discretionary time. So there are a number of things that have really drawn on all of our resources and all the policing people here in the second wave.
In a lot of the interviews that I've been doing, organizations have been able to move more and more to virtual, either virtual interviews or virtual conferencing. That doesn't work all that well for police services, I wouldn't think. You're still definitely at the scene. But have you been able to change anything to more virtual as well?
Certainly, we can't set up virtual arrests because people aren't going to come in, and so when we're out on and we're dealing with activities, we're doing it the way we always have. But the courts have really had to streamline their efforts, and what hadn't changed in hundreds of years based on tradition and the way it was always done was forced overnight to modernize. And the changes at the courts have been astronomical, and they've done a wonderful job implementing those changes. There is a huge delay because of closures and backlogs as a result of not being, not working the regular shifts, because there was never a time there was a quiet time at courts, but now they're even further behind. So a lot of those have gone to virtual formats, virtual court appearances, things like that. And so that's probably been the biggest change for policing, is the court side of it and the court testimony and things like that, where you don't necessarily have to have people there. And similarly, not necessarily taking a body from here up to the courthouse, but doing it virtually. In that regard, there have been a number of efficiencies that have realized that will probably stay in long after the COVID pandemic.
So out of something not so great, which is a pandemic, there has been some opportunities and some positives around efficiency, and not that you look for a positive to a pandemic, but it sounds as if there have been a little bit. What are you hearing back from the community? I'm not sure, Jason, if you can answer that, but what's the community saying back about how they're coping, but also how the police service is helping them, or what are you hearing?
Well, connecting with the communities, and certainly our community partners, we have a lot of fantastic community partners, and trying to be as efficient as we can, to streamline things, but also to make sure that we're we're partnering with the right folks, with the call volume that we have and the people that we're dealing with on an ongoing basis. But I would say, and we talked about this earlier, Carol, actually, before we actually started the meeting, that the community around here has been really fantastic. It's always been fantastic to the service and the members. Obviously, if someone's getting arrested, they're not maybe so excited about it. But I think, we're talking in generalities, the community has been great. The partnerships have been wonderful. The schools have been excellent to deal with. And people obviously have some heightened anxiety certainly over the pandemic, and they're fine to voice those concerns. We try to be out as much as we can, as often as we can, doing education when possible, and then if we need be, definitely we'll do enforcement to keep the community safe. But I think really, when you look at the overall numbers, it goes to show you to the power of what the community does when they do come together, and it's no different from a policing side, and we couldn't be more appreciative of the community support that we receive on an ongoing basis, and we're happy about that, and we're happy to be policing this community.
I know that we've talked. Oh, sorry. Go ahead, Chief.
If I could just comment on that too, I think it's important to recognize that with everything that's going on and the fact that we're going through a pandemic, we're not just sitting back and doing things the way we've always done them. Our community partners, we're meeting with them. Our mental health response is being reviewed at the present time as to what's the best use of police resources, what's the best use of community resources, how can we improve that so there's a better outcome for the individuals in the community. And so despite everything that's going on, we're still moving forward with plans and progress. So I think that's important. In the same way with community safety and well-being planning, that's continued on. Gray and Bruce is probably one of the few areas that still maintain the timeline that was provided prior to the pandemic, and we're on track for that. And I think the leadership group there needs to be recognized for that. And Now we're looking at what tables and what interventions are going to be in place, and we're revamping the situation table with all of our community partners. So I think it's important to realize that despite the fact that everything that's going on around us, we are continuing to look and optimizing how we're doing our business, how we're trying to move things away from police response and into community response and proactive and things like that, despite our demands on everybody in the community.
And I think that's a really, really important point, that when a lot of us are hunkered down and just staying isolated, it sounds like the police service is continually out there making changes in your model of delivery, planning for changes in the future around mental health. So you're still out there making these things happen while the rest of us are staying as secure and safe as we can be within our environment, for sure, and that's amazing. So
it's been,
I know
Zoom calls is unbelievable these days.
Yeah, I know that we've talked about the opioid crisis. I'm wondering what you're finding about calls for women or others who are potentially experiencing violence within their home situation because they are isolated or because of the stressors. Are you finding that that is making its way and more of an impact for the police services in our community?
There have been a number of services that have come out that said the numbers are on the increase. Speaking to our community partners at the women's shelter, they're receiving more inquiries and more calls. Yes, anytime there's stress in the community and there's stress in relationships, we identify that with an upturn in conflict in general, whether it's intimate partner violence or whatever type of conflict that is. And we recognize that early on, and I have to give credit to Jason here because they introduced the Here to Help Grey Bruce campaign, and then just recently, Jason, you might want to go into reintroducing that again.
So Jason, your role may expand as well after, depending on what we experience. I mean, people are anticipating at the end of COVID, things are just going to be back to normal. I'm not so sure. What do you think from your role in the community afterwards? And we have only a minute and a half on that.
I would say that there's definitely probably going to be a bit of an expansion to the role, and it just continues with the community outreach portion. But again, that's when we leverage our partnerships and try to do as much as we can with the partnerships that we have so that we get the greatest outcome. And I think that we're, as the chief said, we continue to move forward. Pandemic or not, there's lots of stuff that needs to be done, and we're at the table.
I want to thank you both for being on the program. This has been so helpful to know how you've been managing, and also to understand that the first responders are also experiencing the stressors from the ongoing pandemic pressure. So our best wishes to all of you and to the first responders, and thank you for keeping our community safe. I want to also thank our viewing audience for joining us today to learn more about programs and services available to you and to your family. Please do not hesitate to reach out to those resources that are available if you are finding that you are feeling stressed. There are numbers to call, including 211 if you are not aware of who can help you, and they will help to guide you to the resources that can support you and your family during this time. We encourage you to continue to follow the Public Health Unit guidelines, and please take care, stay safe, and care for each other. Thank you for watching this program.